Tell us about yourself. What are your strengths? What are your weaknesses? Why should we hire you? This sounds simple, right? But in a junior doctor interview, this question can decide whether you get the job or not. Hey guys, welcome back to my channel Dr. M Inspires. I'm Mahesha. I'm one of the international medical graduates currently working in Australia. And if you are new to my channel, don't forget to like, subscribe and share because I share tips and insights to help you find your first job here in Australia. Today we are going to dive into the personality-based questions. These are the questions that interviewers get to know who you are as a person, not just as a doctor. They want to know how you think, they want to know how you work in a team, and they want to know if you will fit into their hospital culture. So these questions can be asked in different ways. So what's important is to know if you know how to structure yourself when these questions are asked in different ways. So why do they ask these questions? Hospitals know that being a junior doctor is not just about medical knowledge. It's about teamwork, it's about communication, it's about resilience, it's about professionalism. So your personality and your soft skills often matter as much as your clinical skills. And for you, this is the first question that you get to market yourself to get the job. And if you don't start strong here, I would say you've already lost half the battle. So what are the common personality-based questions that can be asked in an interview? Let's go through one by one. Talk us through your CV. Tell us about yourself. What is your biggest strength? What is your biggest weakness? Why do you think we should hire you, or why do you think you're the best candidate for this role? Tell us a situation where you handle stress or pressure. A quick tip to start off with: you have to be genuine but professional. So they want to know the real you, not just a memorized textbook answer. So you need to sound like you're talking about yourself and not about anyone else. So you have to practice. You can memorize, but you need to practice so that it comes out of your mouth very fluently with a flow, and you have to sound like you're talking about yourself. Questions like tell us about yourself, talk us through your CV, or why do you think you're the best candidate for this role? So I think these three questions can be answered using the same structure because basically they are asking the same thing in three different ways. So for questions like this, I used a structure called CAMP, C-A-M-P. So C is for clinical, A is for academic, M is for management, and P is for personnel. So basically, if you include about yourself in these four different sections, you're basically answering the whole question. So let's go through one by one and see how you can structure each section to answer very effectively. So let's start with C for clinical. So keep it recent and relevant. Focus on the roles and the rotations that actually matter most for a junior doctor position. And highlight the variety. Talk about the different departments that you've rotated across. And then emphasize the skills. It's not just about listing the rotations, but talk about what you gained or what you learned. So that shows that you're ready for this role. Okay, so let's go through an example. But before we start off with the example, when you start answering your question, I think it's always important to start off by being thankful. So you can start by saying, thank you for the opportunity given to me to interview for this position. Okay, so let's go through an example. So I would probably, this is how I would structure my answer. I completed my MBBS in year 2021 in Sri Lanka, and I went on to do my internship across medicine, surgery, and also emergency medicine. Clinically, I have developed strong skills in managing acutely unwell patients, performing common procedures like cannulation and suturing, and also working within multidisciplinary teams. I also worked for 6 months in pediatrics, which gave me confidence in communicating with both children and their families. And these experiences have prepared me to adapt quickly and provide safe patient care in busy hospital environments. So that's how I would structure my C. So let's see how we get on to A from C. So A is for academic, and this is the place where you can talk about any formal teaching sessions you've done, or any audits or researches or any papers that have been published. And if you have engaged in continuous professional development, you can talk about them here. So let's see how you structure an answer in this section. Academically, I have continued to build my knowledge through ongoing education. I've been part of an audit on antibiotic stewardship, which taught me the importance of evidence based practice. I've also presented a case study at a local medical conference, and I have completed several CPD courses, including advanced life support and clinical communication skills. So M is for management. So this is the place where you can talk about your leadership or delegation tasks and organizational skills, and you can talk about your teamwork. And if you have done any problem solving or initiatives, you can also talk about them here. This doesn't have to be very long, but you can structure it like this. I've often coordinated ward rounds and dedicated tasks to junior colleagues while ensuring patient safety. I've also supervised medical students during their rotations, helping them learn procedures and understand hospital protocols. And during busy shifts in the emergency department, I learned to prioritize tasks effectively, communicate clearly with the team, and also manage the patient flow efficiently. Personal. So this is where you can talk more about yourself, I would say, in a more personal tone. So you can talk about your motivation in medicine, you can talk about your personal growth, and you can talk about your soft skills, and if you want, you can add a little bit about your hobbies and interests. And this is the best place you can talk about your long-term career goal. So I would put this part like this: I'm committed to providing patient centered care, and I plan to pursue the basic physician training pathway to further develop my skills. I am reliable. I value empathy, teamwork, and resilience, which I've practiced in busy clinical settings. Outside of work, I stay engaged through music and also volunteering, which keeps me balanced and connected to the community. And I believe these experiences equip me to contribute positively to patients as well as the healthcare teams in Australia. The next question: what is your biggest strength? So, this could be anything. It could be communication, it could be teamwork, it could be adaptability, it could be anything. But please don't pick something generic like I'm hardworking. I think many of us are hardworking. Okay, so whatever the strength that you pick, make sure you can give a very good example to show that that is actually your biggest strength. So let's see how you can structure an answer for this question. My biggest strength is clear communication, both with patients and colleagues. During my internship in a very busy emergency department, I often encountered patients who were anxious and struggling to understand their treatment. I made sure to take time to explain their care in simple terms and checked for understanding, which built trust and reduced anxiety. With colleagues, I always gave structured handovers to ensure continuity of care. I believe strong communication will allow me to contribute effectively to the healthcare team here in Australia. So, whatever the strength that you pick, make sure to back it up with a very good example. And also, I would say be ready with at least 3 strengths, so that if they ask the question in a different way, like what are your strengths, I would say at least you should name at least 3. So practice at least 3 strengths, and make sure you have very good examples to go along with these strengths. What is your biggest weakness? So when answering a question like this, I think it's very important to choose a safe weakness. because you don't want to sound like you're an unsafe doctor. You don't want to sound like you're an irresponsible doctor. So also what is important is that you know your weakness, so you've acknowledged it, and also now you're working on it. So you need to show that I am trying to do something about my weakness. So let's see how you can structure your answer for a question like this. My biggest weakness is that I sometimes take on too much responsibility myself rather than delegating. During my internship, I remember I would often try to complete all the tasks quickly instead of asking for help, which could make me feel overloaded. I've recognized this, and now I actively prioritize tasks and communicate with my team when I need support. This has improved my efficiency and ensured that patient care is not compromised. I believe teamwork and asking for help are essential, especially as a junior doctor. They might ask you a question like, how do you handle stress or pressure? So in questions like this, what is important is that you know the reality, to show that you know the reality by telling them a practical example where you actually handle stress. And also it's important to tell them what strategies you used to handle this pressurized situation. And also you need to tell them that by using these strategies you were able to come out of this and you handled it very effectively. So let's go through an example. Stress is part of working in medicine, and I've learned to manage it effectively. For example, during my medical ward rotation, I once had several unwell patients to review while also being asked to complete multiple discharge summaries before the afternoon. Initially, it felt very overwhelming, but I took a moment to pause. I prioritized the sickest patients first and then structured the discharge paperwork in order of urgency. I also communicated with the nursing staff and my registrar to make sure nothing important was missed. By staying calm and organized, I was able to handle the workload without compromising patient safety. So this shows that you have already faced situations like this and you used your strategies and you were able to come out of this situation, and patient safety was not compromised, and you also used your communication skills to delegate your tasks and also ensure that all the jobs were done without an issue. Alright, guys, so that's it for today's episode. So, we have gone through the most common personality based questions and how to answer them. So, please make sure to give examples from your own journey. Keep them structured and concise, and also don't just show them that you're competent, but also show them that you're approachable, you're reliable, and you're willing to learn. I hope this was helpful. If so, put a like and share among your IMG friends. And don't forget to subscribe to my channel so that you won't miss my next episode, where I'm going to talk about how to approach the clinical based scenarios. So until I see you guys in my next video, take care.